Okay, I think we're going to get started. We have a great number of folks on the line already. So for those of you that just joined, I'm Hemi Tewarson. I'm the Executive Director here at NASHP. Welcome to this informational webinar on our new Aging Policy Academy. We're very excited that you're here, and we are here to provide you with more information. So please come with an inquisitive mind. We wanted to ask, just because this is a webinar, we can't see all one another. If you just can put your name in the chat and what state you're from, and that way we'll just know what states we have on the line as part of this webinar. That would be fantastic. The other thing I wanted to note is we have the Q&A open. So ask your questions as we go through the information. You can feel free to put that in the Q&A, or you can just raise your hand and we can call on you and ask, and you can ask your question live. So please, that's what we're here for. So we want to make sure that you get all your questions answered today. So do not be shy. So why are we here? So I don't know if we can go to the next slide, perhaps. So Wendy Fox-Grage is here on the Zoom with me, and she's our Senior Policy Fellow here at NASHP, leading all of our aging work. She is going to talk in a little bit about the application, the project itself, some of the details. So more to come from her. Want to also welcome Chris Kohler. He's the president of the Milbank Memorial Fund. After I say a few remarks, he's going to come on and say hello as well. And then we are so pleased to have Caroline Pitcher here on the line from West Health. We want to thank West Health for their support for this project. We would not be here without them. And I know she's very excited to be here and hear from all of you in terms of what questions you may have. Okay, next slide. So just a little bit about, I think you all know who we are and what we do, so I won't say too much about this, but you all know we here at NASHP, we are a nonprofit, predominantly almost fully grant-funded organization, and we're really here to support you in advancing your state health policy ideas and solutions. Next slide, please. And so really wanted to talk about why we are kicking off this Aging Policy Academy, and I'm very excited about it. So there's a couple of reasons, and I think you all will probably share in these reasons. We have a rapidly aging population. Most want to age in home and community settings. And I think during the pandemic, we've seen a rise in that of people really wanting to be at home, an alternative to a nursing home. Of course, some folks don't have that option, need nursing home care, or don't have the support they would want in a home setting. And so this is a challenge of, how do we really accommodate what people need when we have more and more people that are falling into that category. The high cost of care. We all know healthcare is expensive. It's gotten increasingly so for consumers. And really thinking about what options folks have as they age and the services that they need, I think is critical to the work that we want to embark on in this project. Workforce shortages, especially direct care workforce. So across the country, I think we've all experienced shortages in our workforce. The long-term care services supports and nursing home workers were always slim and always challenged. And during the pandemic, we saw that really become even more acute. And so thinking about how to really engage the next generation of workforce and how to really address the shorter and longer term challenges, I think is also something that we would like to address in this project. And then I already talked about the COVID pandemic exacerbation of all of these challenges: cost, workforce, nursing home, and family caregiving issues. And I did want to just call that out. I think most of you know NASHP is very committed to our family caregiving project, and we were before the pandemic, and I feel like since the pandemic it has become almost more so, because people had to care for families in their homes and other locations when we were in lockdown, and now there's a renewed interest in how do we really support family caregiving and what's the future trajectory of that piece. Okay, next slide, please. Okay, so before we get to these objectives, I just wanted to take a moment to just tell a little bit of a sort of a personal story and excitement for this project. So one of the things, prior to NASHP, I was at the National Governors Association, where I led the health division. And one of the things I saw there was really not a lot of interest at sort of the gubernatorial level for aging topics. What our big governors conferences, it was never a topic that got onto the list to be discussed. And I really thought, we need to have sort of more attention, support, and thinking around what's the future of aging policy in states. And so I wasn't able to launch a project there because I was about to do that and the pandemic happened. And then I left NGA and I got to NASHP. And NASHP, I was so pleased to see, had such a strong aging team that worked on aging and disability issues. And so I thought it was a real opportunity. And talking with Chris, and he'll reflect on this as well, we've been talking for years about really working together and thinking about what can we do as a cutting edge, impactful project for states on these really difficult issues, such as nursing home reform, thinking about what's next for home and community-based services, and really addressing the direct care workforce. So what this project is really to provide actionable, not solutions necessarily, but strategies and support for you all as you think about how to navigate these topics. And Wendy's going to talk about in more detail your ability to pick 1, 2, or 3 of the areas in your application if you chose to apply. But I just want to let you know that really the momentum behind this project is really seeing over the years of really wanting to have more executive leader support and legislative support for thinking about what comes next for aging policy in states. And really, I really feel like we have a moment in time now, seeing where we have been in the pandemic and where we need to go in terms of really taking actionable steps for the future. So I'm going to stop talking. I'm going to turn it over to Chris for a couple of remarks, and then Wendy's going to really lead us through the application and the process that we're undertaking for all of this. Chris, I'll turn it to you.
Thank you very much, Hemi. And hi to everybody here. I want to echo Hemi's thanks for your interest and for attending this. For those of you who aren't familiar, the Milbank Memorial Fund is an operating foundation whose mission is to improve population health and health equity by collaborating with leaders and decision makers and connecting them with evidence and sound experience. We work a lot on leadership development, and then we work in specific areas, including primary care, total cost of care, and aging. And we also do publications like the Milbank Quarterly. I want to really thank Hemi for her leadership on this. She speaks truth. She and I have been talking about this for a long time, and it's something that's really important to her personally. And I give her credit for sort of keeping the flame alive, and also to West Foundation for their support. We would not be here if it wasn't for Carolyn and her team and their ability to sort of see the importance of this. I would encourage all of us as we think about this to don't forget or just to call out the personal stories that Hemi was referring to and what motivates it. I was just thinking as we were getting ready for this, 4 years ago next week was the death of my 96-year-old father. I had the privilege of accompanying him through that process, but it also meant that I was trying to manage from 6 hours away how he would deal with things like direct care workers who didn't quite know how to make the peanut butter and jelly sandwich the way that he wanted to, or hospital discharge planning or things like that. And everybody has stories like that. And that's the experience I think that we and you as state leaders have the chance to tap into, particularly at this moment, as Hemi noted, when we're all coming out of COVID. There are serious questions about the viability, the sustainability, the effectiveness of the nursing home model. But there are also serious questions about what are the services we want in the community? How do we measure that kind of quality? And how do we find the staff to be able to provide those services? So in designing this, Wendy, Hemi, myself, the folks at West really tried to find kind of the sweet spot in terms of the policy initiatives. Not too broad, but not too specific, and to try to provide guidance in these or identify these 3 particular issues: nursing homes, home and community-based services, and the direct care workforce, and to learn from the states that have been leaders on this. And I think the kinds of things that we've learned that are reflected in this project are you got to focus, you have to have leadership commitment and interagency coordination. And then we can't do it ourselves. We have to learn from one another as states, and we have to get the benefit of technical assistance, all of which is in this project. And I do think that we are at a unique moment when we can act on the lessons of the pandemic and use them in the ways that are appropriate in our particular states. So
But we're losing.
NASHP for their support of this. And I'm going to hand it over to Wendy.
Great. Thank you so much, Chris. Hemi, we're excited about this project, and many thanks to West Health and Carolyn as well for her leadership on this. Chris, I think it's apropos that I'm following you, because when I think of this project, I keep thinking about when you started this, is that what we want, the big objective is we really want states, and I hear this in my head from when you said it the very first time when we talked about this project, is we really want states to get stuff done. That's in these topic areas. And boy, COVID and the pandemic really changed things. So I think the timing of this, even though, many of us have been working on long-term services and supports for a while, the timing is everything. So next slide. Let's get into the logistics here. So the way we've set this out is that we are leaving it up to the states in their application process. They can pick 1 or 2 or 3 tracks to work on. We tried to name about every single topic area in each of these 3 areas of home and community-based services, nursing home reform, and direct care workforce. But, and this is kind of the biggest thing that I have to say, is that we want you to realize, that this is a 1-year project. So we want you to be really realistic about what you can get done in 1 year. We're hoping we can apply for funding, and we're hoping we can maybe make it a 2-year project. But for now, we have to just count on the 1 year. So that means things like this, is that if your state chooses to apply and you want to take on all 3 tracks, right? You want to, because you could say, oh, nursing homes and home and community based and the workforce, it's all interconnected. So if you say, I'm going to do all 3 policy tracks, then what you might want to consider is, because we want you to really get something done and have something to show for it at the end of the policy academy, then you might say, okay, then the way I want to go is I'm going to do a strategic plan, right? If I'm going to take on all of long-term services and supports. Or what you could do is you can, with each of the policy tracks, you can pick a concrete item and then say how your approach would be. So in the application, we ask, what do you want to accomplish and what kinds of TA do you need? But so it's important that, we are open to whatever your state most needs, we will flex and create, between TA and meeting with other states that have maybe done that, pulling in the appropriate national maybe experts or state experts that help. We'll flex, but we're really counting on the states to say what they most need and then what the outcome is. Like, what would success look like? Okay, next slide. Okay, so this is how we're proposing to help states. For this particular academy, we will not be giving states grant funds, but instead, it's all kinds of TA. So within each of the tracks, we will have, expert consultants who can provide very customized, very individual technical assistance. You'll get to meet me in person, as well as the team and consultants, because we would plan on having an in-person site visit in your state to really make this happen. We have such a short time period that we would be meeting virtually with you over a Zoom call and your team each month. And then quarterly, we're opening this up to 5 states to be involved in this. And we want the 5 states to learn from each other as well. So each quarter we would have a virtual meeting where the states would learn from each other. And then the other thing that we threw this out is Chris and Hemi and the whole team and we met with states and we really talked to states about, what would be valuable. And they even brought up, and this wasn't even on my radar, that it might be helpful to meet with federal officials, depending on, again, what you're trying to accomplish. And so we're open to that too, if that's what makes sense for this policy academy. So that gives you a little sense of kind of the benefits of, what would you get out of this academy? Okay, next slide. Okay, so as I said before, we're going to this is a state application. We really would like this. It has to be a state-led initiative. We're looking for the leader. We need a team lead, and that needs to be. We're asking for a state employee who has the policy, decision-making authority to make this all happen. And then it's up to you as to other state leaders you'd like on your team. And we tried to list everybody that we could think of, Medicaid directors, aging directors, HHS commissioners, governor staff, state legislators. So we really want to make sure it is a state-focused, a state-led initiative. But then we're leaving it up to you as to others who you might want to be. We're letting you pick up to 5 members to be on the team. And it could be others. We know many of you work with university researchers who might be able to help you pull data that you might need for your project. Then that would make sense to include them. Totally optional, up to you. We know that many of you have very strong community, county-based aging and disability organizations. If it makes sense, you can involve them, community-based organizations and others. So again, we leave it, the whole team makeup, up to you, but we do really want the leadership with states. Okay, we tried to make this application easy and to the point. We're using a Microsoft form. We're not asking for a whole lot of information, but what we do need so that we're successful in this is we want to basically know, what is it you want to do? What do you want to accomplish to be successful? And then what kinds of things do you need from us? What kind of technical assistance? What kind of experience? What kind of resources do you need from us so that at the end of the year, you can be successful? The strong applicants in this process are going to be the ones that can demonstrate a commitment, right? A state policy leadership and a capacity to really get the job done within the year. Okay, next slide. Okay, so here is our timeline. And the most important thing to note on the slide is February 21st. That is the deadline for the applications. And we need to really stick to that deadline of February 21st because we're on a tight time frame because we really want to get up and going. So after that, within 7 days, we're going to select the states and let the states know. And then 2 weeks after that, on March 14th, we're off and running. We're kicking off and we're having our first meeting. So it is a really tight time frame. Next. Okay, and with that, let me go ahead and David, if we can take the slides down, and we are just happy to open this up for any questions that you might have. I'm so excited about our attendance. We have some wonderful people that have attended. We'd love to hear from you. You can feel free to raise your hand, use that button, and we can call on you and you can ask a question. Hemi or Chris, anything that I forgot to say that you would like to add?
Just remind everyone of the deadline and that we are, which I know you said, but just so everyone's clear. Yeah.
Fantastic. And also feel free to use the Q&A button. We can answer questions that way. The other thing is, while that's coming in, is I know some of you, when you're going to actually start the application process, that's when people usually have questions, right? When they start kind of filling it in. And if you do, let me just give you my email address. You can always email me. It's wfgrage@nashp.org. And I'm happy to answer any questions you might have.
We can put that in the chat.
Oh, great. Thank you. Great team. They got my email in the chat. That was much smarter. Great.
And I think we have one hand raised, Wendy. So Karen, I think I can, you can talk now if you'd like. You should be able to.
Hi, Karen. Yeah, you're on mute. So David, I'm not sure if you're able to help us here, but we're
Karen, if you'd like to ask a question, you have the ability to unmute your system right now.
okay, great. Thank you.
But she made a mistake. She didn't mean to ask a question.
Oh, no problem.
We didn't
Okay.
pay, we didn't pay Adam to say that. Thank you, Adam.
I know, Adam.
Thanks so much, Adam. All righty. Well, as I said, if you have any questions at all, please reach out. And we want to thank so much the Milbank Memorial Fund, and we want to thank West Health. We're excited to partner with you all, and we're excited with all the interest that we have in this. And I'm really looking forward to learning from you all. And then Chris, did you want to?
And one last thing I might just want to mention. So yes, we encourage all of you to apply. It's going to be a pretty quick turnaround once you submit your applications by the deadline, and we're going to get started right away because no time needs to be wasted. But I just also wanted to say, for those of you who may be involved in the Master Plan on Aging project with the Centers for Healthcare Strategy, just wanted to let you all know, or work on ARPA funding and home and community-based services with advancing states. We are in touch with both of those organizations. We are keeping them updated on what work we're doing here. I think all of us feel like it's very synergistic of what each organization is doing, but wanted to just let you know that we are working very hard to make sure we coordinate ourselves amongst all the different projects that are happening. And so if you are a state that's working with either of those organizations or another one, we will do the same and make sure that if you're selected for this work, that we are making sure that we're coordinating at all levels. So I think it's a wonderful opportunity if you're in those working with those organizations or not. So either way, I think it works.
Yeah, thank you, Hemi. I mean, I think if the participants are sort of thinking about how these relate together, in addition to us coordinating with the folks at Advancing States and Center for Healthcare Strategies, there's also, it's a little bit simplistic, but almost like a timeline. I mean, the ARPA money was very, you were given a very short turnaround time to put out plans, and in some cases to get the money out on the streets. The Master Plan on Aging, by design, is a long-term hearts and minds building block, lay out the foundations. And this is kind of in between. It's meant to be a little bit longer term, even though it's a year of planning, a year of support, but the horizon's a little bit longer than the ARPA funds, but not as long as the Master Plan on Aging. And we don't think, and our colleagues in the other organizations agree, there is a sequence to this, that you got to get your plan absolutely in place before you can do anything else, or you got to start with the ARPA funds. So it's all a set of resources for you folks. And maybe I just want to make sure there's just a question about the slides. I'm really going to, just as a participant, I think the issues around nursing homes are really interesting. Not that I'm teeing up that issue in particular, but I just sort of, we've I think struggled with the fact, as Amy said in the start, that folks want to age at home, but a lot of folks end up in nursing homes. And now we've seen the risks associated with nursing home overcrowding. And particularly for our colleagues in rural states, there are real issues around supply, both in nursing homes and of home and community-based providers in rural settings. So, we need to put our heads together to work on this kind of stuff. I think that's the benefit of an academy, is it gets the folks talking to one another, because a lot of the challenges are common, and you benefit from sharing your ideas with one another.
It's also a great chance for us to learn as well, is that we're all working on it together. And yes, thank you for that in the chat. We will absolutely make the slides and the recording available. We can do that right away.
Okay. Well, I think we'll close us out then. Thank you so much for joining us. We hope you have all the information you need, but as Wendy said, feel free to follow up with questions. We hope you all apply. We look forward to reading your applications, and we are really excited to work with you all in whatever way that ends up becoming in the future. So take care. Have a wonderful rest of your Thursday. And thank you.
Thank you, everybody.
Thanks so much.